Hey, long time no see. I am here. um, if you don't know me, I'm Cindy. I was banded in 2011, June 1st, 2011, and now it's June 1st, 2017. So I guess it's my 6th bandiversary, and here I am. That's funny. Was it the first? Maybe not. Anyway, guess we'll talk basics. The highest I ever was 311. I think pre-op weight was 296. Lowest weight was 180. And that was after 1 year. But then, a lot of us, what happens to a lot of us, life happens, this and that happens, and I found that to be true with a lot of my lap band peers, a lot of my, a lot of other YouTubers that were banded at the same time, also kind of either had a revision or don't have the band anymore. I still have my band, but I haven't really used it, I guess you can say. About 2 years ago, I got an unfill, and then I only had 1 cc in there, and I haven't touched it since. Then my aftercare office closed, and that kind of was like, maybe I should, do something right before it closes. Well, they were like, well, we're not seeing any customers, any patients, I guess, customers. So I was like, cool, I guess I'll go see my surgeon. Well, my surgeon didn't have, that machine where you see your barium swallow. And I really, really, really dislike the physician's assistant. Like, so dislike her. Dislike her so much. She's just kind of weird, and she stares at you, and it's like maybe that's her trying to have bedside manner, but really it's just kind of creepy. So I was experiencing let me backtrack a little bit. Around my birthday in January, my boyfriend took me to a steakhouse. It wasn't my decision, it was a surprise, but I guess he's not. Since this whole time that I've been with him, we haven't really, experienced the life of a lap bander. I guess he just didn't think about it. He just, I guess, never noticed that I didn't really eat steak. Steak is, even with 1 cc in there, I just I'm not really able to tolerate it very well. So we go, and one bite in, I gotta throw up. And I'm not one to throw up. Those are just not my symptoms whenever I have dilation. Usually I just have either night cough or some burping and I guess some heartburn. But throwing up isn't one of the symptoms that I get, which kind of sucks because, throwing up is like a good, what's the word? If you know you're about to throw up, you stop eating. Well, with me, I don't have that, kind of like, you need to stop eating. It's kind of like, just like, I don't know. There's just no stopping point, I guess. Anyway, so, I decided to call, and the lady, the PA that I don't like, was like, well, you're not supposed to eat steak, so why were you even eating steak? And I said, okay, well, usually the aftercare would suggest that I go on liquids. So you suggest that I go on liquids. And she's like, no, you're still only supposed to be eating lean meats. Why would I ever suggest to you to, go on liquids? And I was like, that's just what they told me. And she's like, well, I don't know what else to tell you. That is my suggestion. Clearly, she is not very, very knowledgeable on, I guess, aftercare appointments. Since Dr. Hollis, he only did surgeries. He didn't really do aftercare. So then I made an appointment anyway, just to see if we could do something. I had no idea that they didn't have that barium swallow machine, and my insurance doesn't cover it. So I was like, no, we'll just see what happens. And I kind of wanted to go to her and be like, I have 1cc, can you just take it out, just to be safe? Well, then I go and she says 1cc is a drop in a glass of water. And I said, well, I've never been, I think the highest I ever was 5.5 cc's ever, and I asked them to take it out. And she's like, well, I know, I've been doing this for a while. Can you tell why I don't like her? So I go home kind of defeated, and I'm kind of mad at myself because maybe I should have stood up for myself. But somewhere in the contract, in big bold letters, it said, a patient, some paper I had to fill out, it said, if you disrespect our staff, you will no longer be able to be seen by us. And I guess I felt like at that point that I would have just said something and it wouldn't have turned out good, considering almost every surgeon that I called in Houston will not see us or see anybody who doesn't have a insurance that pays that out, or I guess they stick to their practice patients, not somebody else's patient, or it's $300 a visit, which is not really feasible for I guess if you're going to get an adjustment every month or every couple of weeks, it just is not feasible. So then I just go home defeated. I put myself on liquids and see where it goes. And so then my heartburn went away and I was like, cool, I'm good. But a couple weeks later, I started getting night cough, and night cough was rare for me. And at 1cc, I was like, whoa, this ain't good. So I'm like, well, let me make an appointment. Maybe this time I'll convince her to take out that 1cc. So I make an appointment, and I went yesterday because I thought that was my appointment time, but it wasn't, which really sucks because they're all the way on the other side of town. So I go, and I don't see her, thank God. They actually have now, because True Results closed in my city, they closed in December, so I guess they've had a couple months to get their shit together. So now they see clients in a different part of the hospital, and they are able to do barium swallows, and each visit is $120, which is so much better than $300. So of course I was already because I had night cough, because I had all these other things, I already expected to have a dilation. And really I kind of wanted them to tell me, just fucking give up, just fucking take it out, it's fucking done. It's been 6 years, you've already gained all your weight back. Why even continue. I think that's what I want somebody to tell me. But at the same time, I don't want to get rid of it. And it's just like this ongoing mental battle. Anyway, so I go in there. They take a picture to see where I'm at, like where, because I think they were training somebody else to take pictures of barium swallows. And as soon as they took the first picture without taking the actual thing to like that lights up everything, I already knew that there was a problem, because the band, you can see the band in the picture and the band is sideways, and if you know, it's supposed to be at an angle. So then I drink the barium, and like you can see like the pouch is this way when it's supposed to be like a little tiny circle or whatever it is sitting on top of the band. So it was like sideways. So she took out the 1cc, and she was cool. I really liked that woman, nurse, or I'm not sure what she was. And so I'm on liquids, and I don't know, we'll see how it goes. I'm on liquids for 2 weeks, and then she said to move on to semi-solids, which is what the frickin' PA should have told me to fucking begin with. But no, I had to draw it out since frickin' January. Yes. Alright, well, that's my little update. See you guys later.